Good afternoon. My name is Susanna Gurr, and on behalf of the team here at the BC Centre for Employment Excellence, I would like to welcome you to today's webinar. Before we begin, as usual, please take a moment to answer the poll on your screen. If you're participating with a colleague or in a group, please select the most appropriate or common answer. We will close the poll in a few minutes or so and let you know the results. For those of you who are unfamiliar with the BC Centre for Employment Excellence, it was created in 2012 with funding from the provincial and federal governments to act as a research and knowledge sharing organization for BC employment service providers and employers. The Centre's mandate is not only to do innovative research, but also to find ways to share that knowledge and best practices with BC practitioners and employers. We created this webinar series as a way to reach out and connect with practitioners. Through this series, we have been highlighting new research by the Centre, but are also tapping into the knowledge and expertise within the employment services community. You are invited to view the video recordings of previous webinars that we have posted on our website. Today's topic is motivational interviewing. Motivational interviewing is a client-centered counseling approach developed by psychologists to treat addictions and recidivism and intended to help people make effective changes in their lives. Motivational interviewing is an emerging and promising approach in the employment services sector. But what is the evidence? What does it tell us? Is there a role for this approach to help job seekers integrate into the labor market? Manitoba and BC are at the forefront of testing how motivational interviewing can be adapted and used to accelerate transitions towards employment among income assistance recipients. This webinar presents highlights from a BC-based study that built on an earlier successful trial in an employment services center in Winnipeg. I'm delighted to introduce our presenter, Dr. Ruben Ford. Not only does he have an impressive resume, he has also been a colleague of mine for almost 15 years. Dr. Ruben Ford is a research director at the Social Research and Demonstration Corporation, SRDC, a nonprofit Canadian research organization. Ruben has extensive experience in the design and analysis of social policy research initiatives spanning education, employment, social assistance, family well-being, and residential mobility. He directed the Self-Sufficiency Project and Motivational Interviewing Pilot Project, initiatives seeking to help long-term income assistance recipients take up employment and help to design the Disability Supports Feasibility Study and the Community Employment Innovation Project in Nova Scotia. Since 2003, Ruben has directed SRDC's team investigating approaches to increase young people's access to post-secondary education across Canada. Before joining SRDC in 1998, Ruben spent 5 years as a research fellow and senior fellow at the Policy Studies Institute, a UK nonprofit research institute. Ruben holds a PhD in geography from the University College London. Before I turn it over to Ruben, I have a few housekeeping items. The presentation will last approximately 45 minutes. Due to the number of participants, we will be muting the audience throughout the presentation to ensure audio quality. We encourage you to use the questions feature on your dashboards to submit any comments and questions. My colleague Greg will be compiling the questions for Ruben to respond to throughout the presentation, and we will also leave 10 minutes at the end for further discussion. We are recording the webinar and will post a video on our website, along with a link to the presentation slides, with further opportunities for everyone to continue the conversation. With the high number of participants today, we might not be able to address everyone's questions during the webinar. However, the blog will be a great place for you to continue to engage with Ruben and other practitioners. If you lose your internet connection during the presentation, please reconnect using the link emailed to you. If you lose your phone connection, redial the phone number which appears under the Info tab and rejoin. Just before handing it over to Ruben, just the results from today's poll. About 26% of everyone listening in today are not familiar with MI, so this will be a good introduction. 34% of you are familiar with MI but have not used it in practice, and about 1 in 5 had completed training in MI, and about 8% have not completed training in MI but have applied the strategies or principles with clients, and about 10%, 11% are not practitioners but have integrated some of this into your work. Ruben?
Okay. So I'm going to be talking today on results from the Motivational Interviewing pilot project. This is a recent research project. We are planning to publish the report next month. As a research project, we don't have practitioner lessons learned yet. We are still contributing to knowledge about what works and what works for whom and in what settings they work. But I think the Centre felt it would be helpful for the audience to know what kind of demonstration projects are going on, particularly those that are being run in BC. And as this was a recent one, a topic relevant to counsellors and employment service centres, this example would be useful for this audience. The project is called Transitions, which is the shorthand we have for the Motivational Interviewing pilot project for income assistance clients in BC, which will be more of a mouthful. We are focused on approaches that may have relevance for income assistance clients, although motivational interviewing can be used with a much broader range of clients. The focus in this project was on longer-term income assistance clients. We had two objectives with this project. First, to test the feasibility of using motivational interviewing in a public service setting that would combine income assistance offices and employment service centres, and also to determine how well motivational interviewing would actually help clients to improve their access to the labour market and hopefully sustain employment and reduce their reliance on income assistance over time. So I'm now going to move on to our next slide. So the project has been building on knowledge around the motivational interviewing approach in employment services that is relatively recent. One of the first and pioneering projects took place in Manitoba starting in 2008. And it built on a theory that services are often designed with the assumption that clients are in a position to engage actively in changing their lives. And really we're challenging that assumption because some clients, such as those on income assistance, may not be ready to make changes. In fact, some clients may even have lost their confidence in their ability to secure employment. Especially if they've been out of work for some time, they may have lost their motivation to make changes. They may have low self-confidence and low self-esteem, and this may challenge them in trying to make transitions, and this could lead to failure in and dropping out of programs offering services and support. So those who've had clients who have not shown up for appointments, who have not been able to follow through, it may be because they weren't able to make changes in their lives. They weren't ready to do so, and a different approach may be needed for these clients. The important step that may be missing could be helping them to realize that they need to make changes in their lives and to help move them along towards a greater stage of readiness to make those changes. So recognizing that job seekers may be at different stages of readiness, may need different kinds of support, could be of use in employment services. So where does motivational interviewing fit into that? Motivational interviewing is a communication method that's intended to help move somebody towards change, and it works by focusing on exploring and resolving ambivalence as a key to eliciting that change. In other words, it's intended to help facilitate and engage in intrinsic motivation within the client, so they're not being forced to make the change in order for them to change their behavior. In other words, they need to own the need to make the change. Motivational interviewing is not judgmental. It's non-confrontational, it's not adversarial. And this can represent quite a change for some income assistance clients in terms of the kinds of services that they're used to receiving. Motivational interviewing is client-centered, but it's also directive and differs from other client-centered counseling in that respect. It's directive to the extent that it tries to influence the client to make changes in their lives. And it tries to do that by guiding the client to consider making those changes and then to take ownership of making those changes. In implementing motivational interviewing, a counsellor will typically ask open-ended questions, and they'll go through a series of questions designed to elicit responses from the client that could be termed change talk. When the participant starts to use change talk, the counsellor will pick up on this and ensure that the participant recognizes that they are initiating a discussion about the idea of changing in their lives. And they do this, the counsellor does this by offering affirmation and offering also reflective listening, hearing what the client says and then responding to it by picking up on change talk, things that they talk about that refer to making changes in their lives, and asking them to reflect more on that. And at various stages in the conversation to provide summary statements so the client knows where they have got to with their discussion with this particular counsellor. Broadly, what it tries to do is help clients to envisage a better future and become more motivated to achieve it. And as some examples of the things you might be asking if you were using motivational interviewing, you might ask a client how they might like things to be different in their lives, or you might ask them how being unemployed, in the particular case of the use in this project, interferes with the things that they would like to do in their lives. And from their responses, pick up on any inclination they have to bring about change in their lives. Now, over time, that should lead to the participants starting to engage in change talk and recognizing that they own the idea of making changes in their lives. Critical in this process, as well as using motivational interviewing as an approach, is making an assessment of where the client is on the stages of readiness to change. And that needs to be assessed formally or informally before and after using MI. And in this project, we were concerned quite a bit with how that assessment was done and how effective it was. In this project, we used a framework that has been developed since, get the right slide, that has been used since the 1980s, called the Stages of Change model. This has been used in many applications of motivational interviewing to practices involved with changing clients' lives with respect to addictions and in criminal justice, but it can also be applied in employment services field, and more recently, since 2008, has been done so. So the Stages of Change model is the assessment framework that was used for this project. It has a fancier title, the Trans-Theoretical Model of Behavior Change, but Stages of Change is again, an easier mouthful. The idea is that clients will pass through one of 6 stages of change, from being reluctant to make changes in their lives through to not needing to attend to the task of making changes in their lives. And these 6 stages are laid out on this slide. Pre-contemplation, when the client's not considering change because of no perceived need to make those changes. Through contemplation, when the participant first starts thinking about making changes in their lives. Through preparation, when the client is prepared for and becoming determined to make those changes. Through to the critical action stage, when the participant is actively making changes, and often the location where most programming is targeted, it's assumed that the participant will be at this stage. Through maintenance to termination. So maintenance is when the participants constantly attending to making changes in their lives. Termination is when they have no further need to be making changes. However, over this course, of passing through these stages, clients will often cycle back. This is termed recycling. So for perhaps 80% of those who are trying to make changes in their lives, they will move back from, say, action to preparation or even contemplation before moving forward again. So this was incorporated within the project as a framework for assessing the stage of change that the clients had reached. Why was it important to test MI? There has been a formal test of the approach with employment services before in Manitoba. A not-for-profit organization that provides employment and assistance services in Winnipeg tested MI within the stages of change setting in a 3-year research project. And they determined the program to be fairly successful. They had close to 1,000 participants. They found 63% of the program group that received motivational interviewing to move into employment, compared to 47% of the control group, which is a 16 percentage point impact. And they moved into a second phase without a control group and saw the first-time employment and sustainable employment levels increase. But that design involved those who were clients of a particular agency, and that agency may have been certain groups of clients may have presented themselves to attend that agency. They may not have been a broad cross-section of the unemployed in Winnipeg. Also, they may not, only half of them, in fact, were income assistance clients. And so this project was set up specifically to focus on the role of motivational interviewing for income assistance clients. And we're at the early stages of work to find out the effectiveness of motivational interviewing. We need a number of repeated tests in a number of different settings. So with one successful result in Manitoba doesn't mean that there wouldn't need to be further opportunities to learn from the implementation. So this project in BC is another study that contributes to our learning, and we're still in the early days about learning about the effectiveness of this approach. So the test that we ran as part of this project in British Columbia was funded by what was called HRSDC, now Employment Social Development Canada. My organization, SRDC, was funded setting up a project that would train both employment plan workers based in employment and income assistance workers and case managers in WorkBC employment service centers who deal with IA clients to use motivational interviewing in a systematic way to assess its effectiveness in assisting their clients to move towards employment. This involved trying to establish a way to actually integrate MI into their practice and into the flow of clients between these different offices. And it was important that the experience of communications with MI was consistent in both these settings. So they were set up as linked offices so that the use of MI would be continuous for those clients if they were in the group that would be receiving it. Similarly, we wanted to make sure that we were testing a situation where clients who were receiving MI received it in both settings, and those who were going to be compared to who were not going to receive MI didn't receive it in both settings, so we had a valid comparison. And I'll describe how we did that in a moment. The partners who helped us to do this, besides ESDC, included the BC Ministry of Social Development and Social Innovation. Their two income assistance offices provided the clients that became part of the study in 2 cities. And the contractors operating the WorkBC employment service centers in the same cities were also key partners in the project, along with Empowering Change, Inc., which was the motivational interviewing trainer involved in the previous Winnipeg study, also involved in this project, training the workers at both the income assistance offices and at the WorkBC employment centers. Who did we work with? Income assistance clients who were designated employment obligated and who resided in either city, who were long-term recipients of income assistance, which meant that they had been in receipt of payments for at least 12 months, or they were single parents with children who had reached at least the age of 3, which meant that they would have been on income assistance for at least 12 months, but had reached the point where they would be expected to seek employment. You could work with a range of different income assistance clients, but those who were relatively new to income assistance may have higher levels of motivation to return to work. And so the focus in this project was on groups that may have lower motivation because they've been out of work for quite some time. The framework that I described earlier for stages of change has the expectation that motivational interviewing will work in particular for helping clients to move from the contemplation to the preparation stage of change and on towards action, and therefore that those who have reached preparation and action would not necessarily need to receive motivational interviewing. But we determined at the start of this project that using motivational interviewing and being prepared to use it with these clients because of recycling would not actually harm them. And so as we were unsure about the assessments that would be undertaken with the clients and how effectively we'd position clients on their stages of change, all the clients in the program were invited to sessions where MI would be used at least once, so that we could be sure that the long-term income assistance clients who were part of this project had all received MI and that this was a valid test of MI. Having set it up that way, I'll need to talk about a caveat to that after we talk about the participation, but that was the intent at the outset. In terms of how the project actually looked, I've got quite a complicated slide that describes the recruitment and the participation. Essentially, it shows the creation of two groups, a group that would receive MI and a group that would not. But I'll go through it stage by stage. At the beginning, we have the income assistance offices provided with a list of the eligible clients, the people who are employment obligated who have been on income assistance for a long time, and they are invited to take part in the study. Those who agree to take part enroll at their income assistance office, and they complete a baseline survey for the project and an informed consent that allows us to track them over time. We then had an application that assigned them at random either to a stream that would receive MI or one that would not. Those that were in the stream that would receive MI would be set up with an appointment to meet with an employment plan worker, one of the employment and assistance workers who have been trained in using MI, and they would undertake an assessment and follow up with that client to ensure that they use motivational interviewing in at least one interview. Once that client had reached a stage of preparation, after one or more MI sessions, they would refer that client on to the Employment Service Center, and they would be expected to start to receive MI with an Employment Service Center case manager as needed, and receive appropriate services. So the idea behind that flow is that the clients, at whatever stage they entered this process, would be brought up to a stage where they would be perhaps more receptive to referrals and taking on services at the Employment Service Center. In parallel to this stream that would receive that motivational interviewing in both offices, there's a non-MI stream. This would represent the normal situation for clients who don't receive MI. They would, as part of the project, receive a referral to the Employment Service Center, which meant that they were notified about its location and recommended to attend, but there was no compulsion to do so. So both groups, in the course of their participating in this project, receive a referral to the Employment Service Center. And we had to incorporate that in both groups because otherwise potentially we would be compounding the effect of MI with the effect of a referral. And we wanted to be sure that we were seeing what the effect of MI was in addition to being referred to an Employment Service Center. The clients in the non-MI stream who went on to an employment service center, they would potentially be eligible to register with a case manager. But if they were to be registered with a case manager, it would be one that was not trained in MI, so they would not receive MI. And both groups of clients were then followed up over time with a 3-month follow-up survey, and then we followed up with administrative data, particularly from the ICMS, through to 12 months. So that design enables us to create a group that is able to receive MI and one that does not within the existing system, and allows there to be a continuity of receiving MI between both IA offices and the employment service centers. We'll go back to how that worked in practice in a moment and how many people we recruited. Very briefly, I'll tell you about our data sources. We have data from surveys on a range of outcomes. Of course, employment was a key outcome, but we also felt that many clients may move along on a continuum towards employment, but not actually move into employment. So we had questions about their employment seeking, their confidence in their own ability to seek employment, how clear they were as to what their employment goals were. We asked them about their reasons for seeking employment, whether they had any particular barriers, childcare, transportation, and so on. We also asked about their education and training, other limitations they may face from health or physical conditions, and we included a number of change readiness assessments, standardized tools designed to measure where clients are in terms of their readiness to seek employment. We have data from administrative records that we're able to track clients' progress through the system. And we also have data from our own application that collected the data on the client stages of change. The Eureka, the URICA, is one of the instruments that can be used to track a client stage of change, and formalizing the process of tracking their stage of change was done in this project. We had an assessment that was administered as part of the surveys and was intended to be used in each motivational interviewing session. So now we move on to the actual research project and what we managed to complete in the period that was funded by ESDC. The program successfully enrolled and randomly assigned 154 participants. This was quite considerably short of our target. We had hoped that in this project we would be able to include more in line with 400 participants. But we were only able to pursue the recruitment for a period that was funded a little over a year ago, and we had to curtail the recruitment even though it was possible to continue, and that meant that we had to stop short of our target. So our results are somewhat limited by the size of our sample, but the project was successful up until the point when we had to curtail the recruitment. We have equivalent groups created, both program and control group, of similar size, similar levels of completing the assessments. And for this group, which is long-term income assistance recipients, very good response rates to our follow-up survey. Around 71% completed our follow-up survey. One of the advantages of creating a program and a control group is that we have very similar characteristics between the two groups. When it comes to comparing them, we will know that the receipt of MI is the difference between the two groups and not any other characteristics that they have. There were no significant differences between the groups in terms of their demographic characteristics, the scale measurements that we did, or their levels of income assistance receipt. This table summarizes those differences, but also helps you to understand a little bit about the groups that we were working with. Broadly split between males and females, with the modal age group 35 to 44. About a quarter were single parents, and close to 90% born in Canada. Roughly 1 in 6 were Aboriginal, and relatively low levels of education. Because these groups are very similar, and using the random assignment technique meant that we created similar groups, we obtain a very valid comparison compared to what might normally be done if we were running a program that was targeting a particular group, such as Aboriginal youth. We might try to compare the outcomes we had for our Aboriginal youth to what was happening to Aboriginal youth generally. But those Aboriginal youth would not necessarily be the kinds of people who would be coming forward and volunteering for the program. So we might not be comparing the same things. But with this project, we are very sure that we are comparing very similar groups who received MI and those who didn't. And that means that we're very confident of the precision of our results. I'll move on to the next slide, which gives you one of the caveats on that statement, which is that although we didn't have a significant difference between our samples in the program and control group, we did see some interesting differences in the extent to which they were work ready on a number of the assessments that we were providing. Now, there are two ways of looking at these charts. They show you the proportions who are at different stages of change. The lighter green is the earlier stages of change, pre-contemplation. Those who are in preparation are shown in red. And one thing this tells you is that different assessment tools give you different assessments as to what stage of change the clients are at, which is an interesting finding in itself. But also there was moderately more pre-contemplation and contemplation among the program group than among the control group, which suggests that there was slightly more disadvantaged group, which is a good group to try to test out MI on, because if MI does create changes for that group, it won't have been biased by any predisposition towards preparation among that group. Sorry, I have to go the other way. So we had training for the EP EAWs and case managers in using MI and in using the assessment tools. And these individuals used the Eureka assessment as well as their own subjective assessment of what level the client was at on the stages of change. The Eureka assessments themselves were uploaded to an online application, which we were able to download ourselves. And these data are the evidence that we have that MI sessions took place. When an EP worker or a case manager uploaded the assessment, this was an indication that they had undertaken MI with the client. We only have around about half of the program group with these assessments from more than one session, and we only have about 41% who have these from activities after the first week. So our program group has certainly got individuals within it who have not received MI and who are not receiving MI after the first week. So these are people who joined the study and were assigned to the MI stream, but then showed an unwillingness to show up for the appointments in which they would receive MI. We do include them all in our study because we want to know how making MI available makes a difference, not how mandating it makes a difference, but making it available makes a difference. And we are including the equivalent people who would also be reluctant to take up appointments in the control group. But it's another lesson learned from this project that simply inviting people to an MI session doesn't mean that they will come and therefore receive MI. And what we do with the people who are invited to do MI but don't take part is difficult. It's a question that we need to try to tackle because we won't be able to use motivational interviewing until they are in an interview where they're able to receive it. The impacts of the intervention on these program and control groups are shown in the next couple of slides. There are different ways of looking at employment outcomes. We have the administrative data that tell us about who is receiving a work support allowance or has been subjected to an earned income deduction. and we see more of the clients in the program group receiving MI than in the control group in receipt of these allowances and deductions. We have results that achieve statistical significance between these two groups at around the 5, 6, 7, and 8 months mark. But I think important to note on this graph is how few clients overall in both groups are receiving those. It is the case that only around 1 in 7, even after 12 months, are in receipt of these work support allowances and deductions. But these results, although they point to not that many people moving into employment, do point to an MI effect. We have a similar result from our survey, which we did at the 3 months point, 3 months after the clients start to receive MI. And we have an impact here because the proportion in the control group who reported that they were working declined from about 4% to 2%, while the proportion who were in the MI stream went up from 3.5 to 9.4. That represents a close to 8 percentage point increase in the number of MI stream clients participating in work compared to the control group. These results come from the survey, but they're fairly consistent with the results we get from the administrative data for everybody. We don't see very much impact in terms of education. We see participation in formal education decline a little among those in MI, but then participation in non-post-secondary programs did increase rather more. So the overall impacts are pretty much level in terms of types of education, but it's interesting that the types of education that clients pursued changed with the intervention. And another indication of the types of training that clients were receiving, there's a broad range captured in the administrative data. I only really want to draw attention to the bottom of these charts, which show the types of services being received, types of training being received. None of these differences in terms of small numbers of percentage points are significant except for the one at the bottom, which is short-term orientation and certificate training, things like first aid certificate training. These differences are significant. The people in the MI stream are more likely to be doing those kinds of training at each stage that we followed them up. In terms of the broader impacts on service use, we had anticipated that the MI stream would be more likely to go to the Employment Service Centre as a result of their referral, but we know that not all of them actually even got to the appointment to do the MI to get the referral, whereas everybody in the control group got referred to the centre. And these things seem to have balanced out, so we have very similar rates of enrolling at the Employment Service Centre, around 30% in the first 3 months and around 45% by 12 months. And there are no differences in case management levels or in participation in workshops. Similarly, there were no impacts, although there was a very small reduction in the amount of benefit received. There were no significant impacts on the amounts of benefit received over time. So although we see impacts on employment, we're not seeing a lot of impacts in the measurable services that were being used. We also see very few impacts on any of the other things that we tried to measure. So job search clarity, barriers to employment, health, life satisfaction, work readiness, and self-determination. There appear to be no impacts on these outcomes. And furthermore, we do see some apparent negative impacts on some of the measures that we included in the survey. The number of job search activities appeared to go down. That may happen because some more are in work, but still the number of job search activities and the intensity of that job search appeared to decline on the questions that we were asking. How well clients felt they were performing their job search. Their assessments were lower if they were in the MI stream. Their confidence in performing those tasks was lower. And on the actual assessments of change, we had the program group assessing themselves at a lower level on the stages of change rather than the anticipated higher level, which is an interesting conundrum because we have here no impact or negative impact on some of the employment readiness, attitudes, and activities. yet we have positive impacts on short-term training, employment participation. So on the assessments and the scales, the impacts are 0 or negative, but on the behavioral outcomes, they're positive. It is worth pointing out, of course, that the target sample of these long-term IA recipients normally make no progress towards employment, very, very little. In fact, it was negative for the control group. And it's reported to us by many of the people involved in this pilot that the long-term income assistance recipients that we were dealing with face multiple barriers to seeking work. Many had addiction issues or mental health issues which may interfere with or need to be resolved first before MI could have an effect. So it is possible that the relatively small level, 8 percentage points of induced employment by motivational interviewing could represent quite an achievement given the presence of the level of these barriers. So what does we conclude for the future? Well, as I said before, we may be seeing some conflicting findings, and if we place more faith in the behavioral assessments, we've got a somewhat positive story, but we've still got a quite substantial group of people for whom the offer of receiving motivational interviewing didn't make a difference. But then we're also seeing some negative effects, and it could be because the assessment tools are not performing effectively. They may not be answered honestly by clients who are feeling there may be some effect on their benefit. This is something we have to take into account in using these kinds of tools. That could be the case, or they could be correctly recording the client's position, but there is a group within those who receive MI who become more disillusioned with their lives and their job search as a result of the MI. That could be the case. And we can't tell that for sure because our sample is very small. And then we also have to accept that we had a fairly small sample, so we could have an error due to that. You just by chance will get small differences occurring. So we would ideally want to be able to expand our study or to replicate it to improve the assessment tools, to be able to draw firmer conclusions about the role of MI in helping clients move into employment. And our recommendations for that would include some refinements to try to screen out of the future tests clients who may face additional barriers that need to be resolved first, connected with housing, addiction, physical or mental health issues. Or if we are going to include them, we include interventions specifically to try to tackle those barriers. So we want to go beyond employment motivation with MI. MI can be used to tackle addiction issues too, and potentially it could be used in the context of this of these kinds of interventions with long-term income assistance clients as the first barrier to be tackled, and then later to use MI for employment motivation. On the other hand, there may be other interventions that are more appropriate first. But we may see larger impacts if the group is somewhat more select on those who have fewer barriers outside of motivational barriers. We also think we would like to do more work with the assessment tools. The commonly used assessment tools didn't perform as expected. We were getting different measurements even at the outset, as well as getting mismatches between changes in behavior and the assessment tools. So there's still work to be done with the assessment tools to make sure that they do pick up the kinds of changes that we're hoping that they will detect. And we don't know from this study, because we combined the experience of income assistance workers and employment service case managers using MI, which of them was making most of the difference. It could have been the MI in one setting or another. So more work would be needed, preferably with a larger sample size, so that we could try to tell whether MI in one setting is making more of the difference for the clients who do make moves into employment than MI in another setting. So as you might expect from a researcher, a call for more research, but I think we have learned some interesting lessons about putting this type of programming in place, and we have a chance now for questions, so I'm happy to open up to those.
Okay, thank you very much, Ruben. Thanks again for your presentation today. And thanks to all of you for attending the webinar today. So we do have, like Ruben mentioned, some time for questions. There were a couple of questions that were posed, or a couple of comments that were posed during the presentation. It was pointed out that the Winnipeg project actually took place between 2007 and 2010 rather than 2008. So just a note about that particular study and project. Also, there was a comment about some of the notes at the bottom of each of the slides may have been cut off. We'll actually post those slides in the link that you'll receive tomorrow. So you'll have a copy of the full slide deck with all of those notes that may have been cut off from the bottom of your screen today. So again, we still have about 5 minutes or so for questions. You're welcome to enter those in the question box.
Maybe I can ask a question. I know Ruben recently presented at the Canadian Economics Association in June the results, and I think a longer presentation as well. There were discussants there. Can you maybe share some of the comments from the discussant about the results from this project, Ruben?
Yes, it was an interesting experience at the Canadian Economics Association. You have a discussant who goes through the report, and they produce a series of critiques. We were given a discussant who took a lot of interest in this project and went through every result with a lot of interest. One thing that they pointed out to us was that the feeling that we had that we were seeing somewhat unexpectedly low impacts was perhaps needed to be revised. We shouldn't be belittling our findings. They said, given experience with other types of intervention, working with this type of client, with a number of barriers to employment, to achieve this level of difference between a program and control group was actually quite remarkable, and that the role of MI in making those changes was very clear and believable from the way we'd constructed the study. So although we tended to play down our findings, they told us that we perhaps should be playing them up a little bit more.
Okay, thanks, Ruben. And a question about or a comment coming in saying, is it not likely that increased self-awareness about motivation and readiness throughout MI sessions might actually be more accurate? And could that be why the scores of readiness were lower?
Yes, I think that's what we started to talk about once we had the assessments, that the participation in the sessions and making assessments of how much one wants to make changes in one's life may in and of itself change how you answer the questions. As with many studies, there are tools that you try to use to assess where clients are in terms of their employment readiness or in terms of their self-esteem or self-confidence, and there's quite a lot of work to try to make sure that these will be robust and work well in a lot of different settings. But none were perfect in that they've been tested with long-term income assistance clients, and this group may in particular have challenges answering questions about their readiness to seek employment, or to answer negatively about how unwilling they are to seek employment. So it is quite possible that first and foremost these assessments are asking questions which are difficult for them to answer, difficult for them to answer honestly, and which also may provide us with some indication that the assessments need either to be adapted so that they are appropriate to this group, or not used for the purposes of assessing the need for MI, and the counsellor's judgment plays much more of a role.
Okay, and one final question before we end the session today. This is a question about the interview specifically. Were there specific tasks assigned to the participants in the MI group, such as lists identifying what motivates them to change in other areas of their lives?
I don't think so. The MI was used in individual one-on-one interviews. So the case managers or the employment plan workers were using the approach of motivational interviewing with the focus on questions like how does not being at work or how does being on income assistance make it pose a challenge for you in your life? Are there things you would be able to do if you were working? And these kinds of topics will be covered, but they were not formally looking at other aspects of their life. I mean, they may have brought them up, but that would have been for the client to do so. So there wasn't like a set curriculum or a set lesson plan, as it were. It's very much a responsive approach to what the client comes forward with, but picking up on where they are talking about change.
Okay, and we just have a note coming in from the trainer that confirming that there wasn't a list. Okay, so that wraps things up for today. And as you can see here on the slide, we are planning our next series of upcoming webinars. As for the session today, it was recorded, and we will post the video of the presentation on our website where you can continue the conversation there. You will receive an email tomorrow with a link to the presentation and video. Unfortunately, we have found that the system does not record those of you connecting only by phone as having attended. So you may receive an email saying that we're sorry you were unable to attend. If that's the case and you would like a confirmation of your attendance, please contact us at the address in the email. As always, we welcome your input and feedback, and we would appreciate any suggestions you have for future webinar topics. A final couple of announcements before we end today's session. As you can see here, we are in the process of organizing that three-part series in August and September on research from the Center's call for papers on youth employment. So keep an eye on our website and newsletter for announcements about registration for those webinars. And at the end of this webinar, you will receive a link to a short survey. It will only take about 1 minute or so, and your feedback will help us immensely for planning future webinars. So again, if you participated in this webinar with a colleague or in a group, please select the most appropriate or common answers. Thank you in advance. And that ends our webinar for today. So on behalf of the BC Centre for Employment Excellence, thank you and have a great afternoon.